lactation consultant. So today, it's another day, another topic that I want to share with you. So today I was thinking to myself, okay, what is one of the most common scenarios that I've encountered in our breastfeeding clinic? One of those is either nipple pain, latching, or difficulty positioning. So today I am going to talk about one of the most famous position in breastfeeding, the nurturing position, or the so-called biological position. Why this position is considered as the best position in breastfeeding. So I'm going to explain to you why. I'm going to explain to you why some moms struggle doing this. I'm going to explain to you why some babies struggle being in this position. So it's going to be positioning and latching today, okay? And I want to say this. I want to break some rules in breastfeeding. Why? Because going back to my experiences with my patients in our breastfeeding clinic, there are so many patients in the past that I've experienced with that they were just so focused on this breastfeeding rule, on how to hold the baby, on how to position the baby, on this and that. So we're gonna break rules today, okay? we want to break rules so that you can be comfortable, so that baby can be comfortable. That's why we're gonna break the rules, okay? If one rule doesn't work for you, we're gonna break that rule, okay? By understanding why biological positioning or lean back position feeding is the most comfortable position in breastfeeding. So based on my nursing experience as an lactation consultant, I've often disagree when other healthcare providers would provide teaching to mom and telling them, oh, breastfeeding is so easy, breastfeeding is so easy. You know what? In years of my nursing experience and as being a lactation consultant, breastfeeding is not really easy. It's not really easy for everyone. It's not really easy for those moms who have preterm babies. It's not really easy for those moms who have very short arm and they're a big baby like this. It's not really easy when the milk is not established. It's not really easy when their breast is so engorged that they don't know what to do. It's not really easy when they're in pain with their C-section and you're gonna tell them to do lean back position or do a cradle position when you're breastfeeding. Breastfeeding is not easy for everyone, okay? It's not easy. That's why I'm here, your lactation consultant, to give you a clear understanding on why so many moms would say, oh, they said biological position is the best, the most convenient, comfortable position in the world when it comes to breastfeeding. Some moms may say, no, Alona, you're wrong. That's not right. So we're gonna break rules, okay? We're gonna understand what really this baby needs, okay? Either you have a preterm baby or a full-term baby. We need to understand why can't this baby just latch and breastfeed, whatever position you're using. Why we have to have these rules that we have to do. So we can break rules today and we can think about, okay, what's the best step or strategy to position and latch this baby. Okay, you know what, when we go back to our history, okay, or like the characteristic of a baby, babies belongs to the so-called upright species, okay? When you talk about species, talk about animals, let's say the gorilla, the monkeys, you know how they breastfeed? They're standing position like this, right? So upright position, baby is a part of that species. And not only baby is a part of that upright position, baby is also a part of that interactive species, or a species that loves to have interaction. So with the biological position or lean back position, or the so-called nurturing position, okay, sorry about these terms because if you read some books, they call it nurturing position. In other books, they call it biological position, or in a very clear understanding, especially for new moms, lean back position. You just do like that. Put the baby on top of your chest, naked, just diaper on. You lean back on your couch, in your bed, wherever you feel comfortable, and put the baby in there. And this baby will pretend that the very, very stubborn baby that do not want to latch, do not want to you're just crying and do not want to breastfeed. So with the biological position, okay, this is comfortable. Why? Only if you don't have C-section, okay, that you're able to do the lean back position. Now, let's say, for example, I have moms coming into our breastfeeding clinic who struggles with a very large breast, and with the positioning, like, let's say we'll do cradle. The mom's breast is so big that the mom's hand cannot even hold it fully while latching the baby. So almost half of that breast is hanging down below the baby's chin, because again, the breast is so big. And if you haven't watched my video about how to latch a baby with a large breast, check that out, because that will help you. Now, when you do the lean back position like this, mom has a lot of access to what she can do with the baby on top of her, okay? Now, if this baby is still not interested to latch, just leave the baby alone. Leave the baby alone. Let the baby just rest on top of your chest, naked, just the body. You can cover the back with a blanket and the diaper, okay? Now, what you can do while you're doing this lean back position, okay, if you really want to interact with this baby, because again, baby is a part of that species that loves interaction. So interaction means you have to connect with this baby. And one ways to connect this baby is tease this baby with the taste of your milk. And how are you going to do that? So while you're doing this, you're massaging your breast, right? You're massaging your breast. Either way, in what position the baby's head is located. So the milk is starting to come out. The milk is starting to leak, right? If you are that type of mom who have tons of milk, but if you have just drops of milk, it's okay. Just let it express it until the baby's like able to smell it. So with that interaction and connection, so the baby gonna be bobbing his head, right? Normally the baby would do that. See, looking, where's that smell? So just observe these little puppies or little piglets after they give birth. They cannot see anything, but all they have to do is just look around, bobbing their head, looking for. So if you're doing that massaging thing, massaging to your breast, so the letdown is there. Especially if you start massaging like a minute or two, just starting to express that milk. So when you have that spray of your milk or letdown, rub it around your nipple, around your areola, or even rub it around the baby's mouth, okay? So just play with it. Let the baby rest there. Do not force the baby. Because if this baby is still crying, laying on top of you, and still don't want to breastfeed, it's okay. Leave the baby there. Leave the baby there. Calm down. Just distress yourself. Because if you are also very tense and very stressed, and the baby is crying there, then there may be no good comfortable positioning or latching that can happen when both of you are very stressed. So just leave it there. Just continue teasing the baby with the droplets of your milk. You can rub a few drops around the baby's mouth and you can use your hand to guide your nipple or your breast towards the baby's mouth. Because when the baby is like this, normally the baby is just focusing down, not looking at you. But if you want to adjust that lean back position sideways, wherein you can adjust the baby's leg this way, and you know that the baby's mouth is directly in contact with your breast, it's easy for you to see if the baby is latching. Now again, remember I mentioned to you, this baby is a part of that interactive species, okay? This baby wants bonding, wants connection with you. So make sure always when you're doing lean back position, it's not that when the baby's looking down, try to adjust the baby's leg. Okay, adjust the baby's legs that you can see the baby's eyes looking at you, because that eye contact, that interaction can really help to promote breastfeeding. Okay, and another thing that you can do if baby is here and still very stressed, not latching, crying a lot, so what you can do, you can start tickling the baby's feet, massaging it, because every time you stroke that feet, I feel so sleepy now. Every time you stroke this feet, baby loves it. And every time you also stroke this spine of the baby, that relaxes the baby. You know, that baby started to calm down when you're doing that. So think about ways on how you can make this baby happy by breaking all those rules that you read in the book. Because there are some moms that they're just too focused on what they read in the book or what they read in the internet, and when they do something different from what they read, they think they're doing wrong. They're doing it wrong. No, just play with it. Okay, experiment things, because when you do things like that you're trying to find ways on how you feel comfortable and how your baby feel comfortable as well, then there is no stress, there's no tension. So there are times that you have to forget about the rules and just do your own thing. It depends, because again, remember, I've been saying this in my videos before. Every baby is different. Every breast is different. Every mother is different. So you can be reading all the rules and latching and positioning and still don't work for you. Do something else. Find the best way that you feel like this is comfortable for you, okay? And you know it when the baby stays at the breast longer than before, when the baby is gaining weight, when your milk supply is starting to get happier, when you're more happier, that means you are doing the right thing. So there is no restrictions on what you can do. Either your baby is preterm or your baby is full term. Just experiment those techniques on how to latch the baby and choose the right positioning that would really make you feel like, oh, I think I'm doing it right. This may be not in the book, but I'm doing it right. I'm happy with it. So go for it. So that's the thing. Babies are born species just like those animals who love to breastfeed in upright position. And that upright position is the biological or nurturing position. So try it. See if that works for you. It may be so relaxing for you too, because you can even rest your back while you're doing this. And if some moms fall asleep while you're doing it, make sure you are in the middle of the bed so that the baby will not fall off, okay? If the baby is still on top of you, okay? Make sure that the baby is safe when you're doing this, because in case you fell asleep, because again, when you're breastfeeding and you have that letdown, you're releasing oxytocin, a good feeling hormone that sometimes makes you sleepy. So when you're breastfeeding for 20 or 30 minutes, you may fall asleep and you don't know that the baby's on top of you. So always promote safety when you're doing this position, because I know it's so comfortable when you're doing that and you may fall asleep when you're doing it. So thanks for watching. I know you learned something from this video. Please share this video, because there's some moms out there still kind of thinking, okay, what I'm gonna do with this stubborn baby that doesn't latch. So again, latching is like learning to dance in a tune of music. You don't get it perfectly for the first time. You may have to do it 3 times, 4 times, 5 times, 10 times tries before you get it perfectly. So again, dance with it when you're breastfeeding. Learn how to break those rules if you're not comfortable, because again, rules are meant to be broken. So thanks for watching. Have a good day. Stick around, more videos to come. Please do share this video. Continue to subscribe. Bye for now.